All right. Hi, everybody. I'm Dave Coulter, the Oakland County Executive, and we're here today with some really special partners in the mental health field. I'm at the North Oakland Health Center here in Pontiac, Michigan, and we're going to do a special COVID-19 update. You know, we're already into June, which is hard to believe, second day of June already, but I want to back up a bit and recognize that May was Mental Health Month, so we're just coming out of Mental Health Month, and it's, you know, it's such an important issue. It's I've done a lot of work in this field. It's very important to me and the residents of our county, and it's really only been exacerbated by what we've seen in the pandemic. Those of you in the field knew it was a huge issue before, but I think we've all discovered how much more it's been exacerbated. So I'm here today with some really great community partners. I'm thrilled that you guys are here. Michelle, help me with your last name.
Ciaramellano.
Ciaramellano. Okay, she's the Community Liaison Business Development from Havenwyck Hospital. And then Erica Saum, am I pronouncing that right, is a suicide prevention program lead from the Community Network Services, wonderful organization. And then finally, relatively new to the role, Dana, how long?
Since August, almost a year now.
Since August. So Dana Lazenberry is the CEO of Oakland Community Health Network. So, ladies, the COVID-19 pandemic, you know, it's caused a lot of stress and anxiety for people and families. I mean, whole communities are certainly, it's, you know, in some ways been a trauma for a lot of people. And there's been a lot of pressure juggling work and family and school and just personal feelings about what we've been experiencing, and, you know, trying to learn remotely and all of the things that have, you know, just in some ways forced some, I would say, isolation among our residents as well. We're not in the usual environments that we're in, and it's very unusual for a lot of people. And I wanted to talk to you today about what's going on in Oakland County and the community at large, and what we've been facing, and maybe better yet for folks that are watching us, you know, how we can protect and better support our own mental health as we start to get back to a new normal. So I'll start with you, Michelle, but any of you can chime in. But let me just start off just sort of generally. How has COVID-19 affected the people that you've seen? What kind of trends have you seen, or what have you been seeing over the past 15 months now?
Well, I'm gonna take this.
Okay.
I did. Hi, I'm Michelle. I do want to say that I'm a social worker because that wasn't mentioned. And
Okay.
I've been at Havenwyck 14 years, so I'm kind of answering these questions based on being a social worker in a psychiatric hospital for a very long time. But over the past few months, I've been working in our child adolescent day hospital, and then I also consulted with Dr. Mikhail, who's our chief of staff at the hospital. So kind of my perspective, but also his perspective as a provider and a physician, and kind of what we've seen at the hospital as a whole. And really what we're seeing is an increased need, obviously. And I think all of the outpatient providers have seen that as well. The need for treatment has grown so much. Patients that had a previous diagnosis, their symptoms are even worse now. So we're seeing a huge increase in individuals that needed treatment before, but now perhaps they just had depression, now they're having extreme anxiety as it relates to the pandemic, the isolation, the inability to engage in normal activities and that sort of thing. For individuals that didn't previously receive psychiatric treatment, which is something I'm seeing a lot, especially in our outpatient program, is the increased anxiety, the increased depression, a lot of additional external factors, domestic violence, the isolation, again, the inability to engage in normal activities. Now that we're going back to school, I think we're really seeing a lot of our youth that we previously thought or hoped were resilient are not as resilient as we had hoped that they would be. The virtual school has been really hard for a lot of people, the hybrid situation, so it's just been very, very difficult. So that's what we're seeing. Obviously not enough beds, not enough providers.
So Erica, Dana, what would you add to that?
Well, I'll add. I'm just going to take this off so you can hear me a little better. you know, and I do want to clarify, I apologize, I'm from CNS Healthcare. That was something that I didn't realize was an error there.
Oh my gosh, I'm so sorry.
No,
Okay,
so that
yeah.
was mine.
Yeah.
So similar though, as an outpatient, our admissions have doubled. You know, doubled.
Yeah.
In terms of what we have, and you know, it's interesting. Michelle had said that we saw a lot of people be resilient, and I think in a time of crisis, you sort of band together and you sort of unite over the crisis, and now it's almost like we had to enter the pandemic, and now we need to figure out how to exit and do so with our, you know, and everyone wants to just turn the switch back on and be okay and go back to normal. But you don't go through something what we just went through and come out normal in the same way you came into it. And so kids, they are resilient, but they still need supports. Parents still need supports. And so, our numbers have just doubled. And some people, you know, this was a breaking point for them. And some, this was just an added layer for them. I'm sure sort of similar what you've been seeing.
Absolutely. And I'm Dana Lasenby. I'm from Oakland Community Health Network. And as Mr. Coulter said, I started during the pandemic in my role, but I've spent 20 plus years in mental behavioral health. And I'll tell you, as a public behavioral health system, we are stretched. You do see an increased number of people who are eligible for services, who are accessing services, or really just need to know how to access services. And so I've said this before, in that I've watched your commercials and your reach out for testing and for the vaccines, and I love it. But we have to address the mental health piece of it, and that's the trauma part, that people were exposed to so much loss, and just not death, but not just death, but loss in terms of normacy. What they knew to be normal was totally erased. So in terms of being isolated, we're seeing numbers of people who weren't eligible for our services before, now eligible for our services. And I think we really have to look at a way to provide those services that meets the needs of the community. So during the pandemic, my team, even before I got there, I have to give them a tremendous amount of credit. They jumped into place and they made sure that providers that we contract with throughout our network were able to do telehealth. So that was a huge thing, so that people did not have to come out in the community. And then we also looked at alternatives to going to the hospital ED, or actually in terms of the residential services we provide, really wanting to make sure that people were taken care of. So there's a lot of social components, but I think the mental health component is the one thing that we cannot think that people can just pop back from. And that making sure people understand and the community is educated about how to access services, also how to be okay with not being okay, and what does that look like? Because again, school changed for kids, working situations changed for families. You have families who were taking care of loved ones that passed away, or you know, you now are introducing your kids for the first time to school, where they may not have been in school when the pandemic started. Babies are born, right? And so there's so many components that really change how we think about mental health. And I'll say the one thing that is a positive that came out of this pandemic is that people are now really bringing attention to it, and the stigma of mental health services is really being addressed. And that's really critical, because people are now saying, I don't feel good, I don't feel right. It's nothing physical, but that emotional part of it is really challenging.
And that's why I'm so glad we're doing things like this, because there's always been stigma around mental health, but I think, like you said, if there's any silver lining, it's that we all have sort of this increased awareness that any of us are susceptible to it, that it can happen to anyone, and it's fairly common. So Dana, I'm going to continue with you, and then I'll ask the other two. But you mentioned the teleservices, telehealth services. That's obviously been a big strategy for the past year. Has it been effective, and do you see that being more of a part of what your providers do going forward?
It's very effective in that we have families who are coming in to receive face-to-face services that are now able to do it through a device, through their smartphones, through iPads. Thank you very much for your support in that. And being able to talk to their therapist online and stay connected and engaged differently was very helpful, because many of us were terrified about coming out in the community. And then for families that are struggling with transportation, with children, many children, the family, you know, to go out into the community was a huge task. So telehealth has helped a whole lot. And what we saw with providing telehealth services to our providers is that people could engage in services, they could stay home safely, and they stayed engaged. So that we didn't see a major increase in inpatient admissions until probably in the last few months. We saw an increase back as people started to get out into the community and really have access to those services. The other piece of it is that although there is telehealth, there is a great deal of people who don't benefit from telehealth, and we have to meet them where they are, and we have to make sure that the providers are ready to receive them. So the other part of it is the workforce. So the mental health workforce is really struggling, just like the healthcare professions. How do you help the healthcare worker?
Yes.
You know, they're fearful. They've seen a lot of trauma and things of that nature, but we forget.
Yes.
We forget that self-care is so important, but also some people really need the face-to-face, that whole iPad, and you can think of our seniors who may not want to even use this device. It's not real to them.
Yeah.
So that face-to-face is critical, and that's part of returning to the new normal, I would say, and then making sure that our network of providers really have the capacity and the ability to serve these increases like Melissa is saying.
Yeah. I'm glad you mentioned the health providers as well, because one of the things that I've been very conscious of as the leader of Oakland County government is, you know, each of us are dealing with our own individual personal issues. And then when you go to work, you're expected to sort of park those at the door, because now you're focusing on other people's issues, and you're supposed to somehow compartmentalize
Turn it off.
sick parents or children at home and all that, and turn that off, and that has to be. So let me ask the other two of you, what kinds of things have you seen in terms of the issues that your employees are having, and that maybe, you know, is education for the rest of us? How do you help support employees in the workplace? This isn't one of your questions, so I'm throwing you off a little bit, but it's an important one, I think, because we got to provide for the providers. And so, are there things that your organizations are doing to sort of support those, and in any of that, anything that maybe our listeners could consider as well? Either.
Yeah. Well, I mean, I'll definitely echo what Dana was saying. I mean, the need to pivot to be telehealth providers so that we can serve those, but it doesn't fit everyone. In the same way for our employees and our coworkers and ourselves, it doesn't fit everyone. And so I think for the same lens that we have in understanding that this pandemic had an impact of those that we serve, it truly had an impact on us.
Yes.
And we've been helping, and that's been a focus, you know, how do we ask for help as helpers?
Yeah.
I think that's a hard thing for helpers to do. We're so used to being in the helper role, and you come to me for advice, I can help you, I can get you the resources, but then how do you turn that around and really ask for that yourself? And so I think as providers in our county, it's going to be important that our organizations are mindful of that, and that they still have, you know, potentially hybrid options for families. I mean, even though a lot of things are opening back up, some families don't have that ability to do such. You know, not everyone's family is open back up and in school or in summer camp. Jobs aren't exactly what they were, and for some, they succeed differently. You know, some people, as much as it took an impact, you know, I am aware of families that have succeeded, you know, in this different kind of environment. So I think being really accepting and communicating with your providers, with your employers, I think that's going to be key, and just sort of being honest and giving some grace as you work through all of this is going to be important.
Michelle, let me ask you another question, and then I'll ask the other ones to chime in if you want to, if you'd like to. But so, looking forward, what are some of the longer term effects that you see? I mean, you know, folks are dealing with things immediately, the anxiety, the depression, of the isolation, the going back to work. But what worries you even sort of longer term in terms of what the impact could be for residents of the county and the region?
I think really the unknown. I mean, I think that we're all hopeful for what the future will bring, but I think that the fear of the unknown is really what's exacerbating most people's anxiety and fear, and so that, I think, is probably what we have to focus on more than anything, is just providing the education and helping support, providing care and self-care, promoting self-care, I should say, for employees and mental health workers and hospital workers. It's something that as a hospital we've been really focusing on building morale and helping support our staff the best that we can. As most hospitals, we didn't close, we've been open,
Sure.
Throughout this entire pandemic, and so our staff are tired and they are going through the trauma at the same time as the people they're trying to help, which is something that historically providers help people that experience traumas, but not necessarily at the same time. And so we're all feeling it. And so I think we have to be aware of that come the future and what that will look like, but it's really unknown.
Yeah.
And so how we can best help everybody is probably.
Yeah. How about you, Dana? What do you longer term? What concerns you?
I think part of it is unresolved grief and loss, and not really having an opportunity to process that. Because if you notice, back in April, a year ago, when someone passed away, you could not have a funeral. You could not visit family. I had a good friend who lost her husband. I couldn't go and sit with her and take care of her the way I would normally, and that was hard for me. I can only imagine how it was for her to lose her husband and have to deal with that grief alone, without family, without friends, without that circle of support. So really, I think long term is, really watching for signs and symptoms where somebody is struggling to get better or to, catch up with things. And I think the telehealth is great, but I think a lot of it is really addressing the fear that people have. Fear of the vaccine. We know it's a good thing to do, and it's going to allow us to get out in the community and open up, which is really good for us because a lot of us like other people. But the other
Social
side
beings
of it,
at nature. Even if you're an introvert, we're still social beings,
to
right?
some level. And
Yeah.
some people are sitting at home happy and totally scared to come back to work, to get engaged, to go to church, to do all the things that they did before.
Yeah.
They're hiding by, I'm not going to get vaccine. If I don't get the vaccine, then I don't have to go back to work. Well, you do. If I don't do this, then I don't have to get back out there. And realizing that some people are introverts, but they're struggling with this fear of coming back to the community and what that looks like. And even with the vaccine, there's so many questions that people have. And are we going to have a booster? So if I have to have a booster, how do I know if everybody around me has had their vaccine? So there's a lot of fear there, and I think it's going to take community education long term, not just now, but ongoing things to really get people re-engaged, but also to make sure that they know how to ask for help, and it's okay to ask for help and where you can go. And that can't go away. I think, again, really partnering, when we talk about healthcare, physical health, we have to include the behavioral health screenings and the things. And then the other thing, sometimes we need to go where people are and not expect that they're going to drive up or show up to a building. They can't. They're just not ready for that. So where can we go in the community, faith-based community, in community centers, near shopping centers, where we can really be present for people and encourage them to come out?
That's a great point, and it leads me to something else that we're thinking about here. Units of government are getting the American Recovery Plan dollars to help us sort of with systemic problems and issues that we have, and certainly I believe mental health is one of those. Like I said, it was underfunded before. I think if money weren't an object, we would treat mental health like we do physical health. If you break your arm, we're going to take care of that, but we haven't always been as good about treating mental health issues. So this money is coming, you can plug for your organizations, but also just what kinds of services or programs do you think, maybe that you're not running now or that you've run at a small scale, that you think would be helpful to scale up, could be beneficial that through some of these funds that a lot of communities, the state, the counties, the cities are going to have access to. And maybe Erica, we'll start with you, but I'd like to get all three of you to chime in so you can plug your organizations and the great things you're doing. But this is something that we're very much grappling with, is how to make a real impact with these dollars. And
I mean, I have a couple thoughts. One is just knowing the increased need that has come out of this. There's a real mental health capacity for providers. There's more need for funding so that we can have more positions, so that we can serve more people. You know, Michelle mentioned not enough beds. You know, we don't have enough staff to see everyone. Caseloads are really high in terms of it. You know, we're still managing, and you know, excellent providers are able to still provide the services, but you can only keep going at that rate for so long. So I think just having more resources available to give to the providers so that they can get to the employees that are needed. And then I really look at some of the prevention services that are needed, you know, within our schools and our youth. You know, there was such a big push of everyone wanted mental health for our kids, but yet we don't have the services in the schools for the mental health for our kids.
Yeah.
Unless they're designated as special education, there is not always in a lot of schools a general social worker or mental health professional who can sort of see anyone. And so those would be things that I would want, and partnering potentially with organizations who provide such school-based services can be a key, so you can leverage dollars that way and make it a little wraparound for the community and the individual.
Great. How about at Havenwyck?
Oh, well, I think that really what Erica said, I mean, we need more providers, we need more staff, we need to pay our staff. I mean, people, we need more money. And so I think it can be used to help improve our services, provide better care for our patients. We need more beds, but we need more people to take care of the patients that we already have as well. And then prevention, we've been doing a lot of suicide prevention 101 presentations that I never imagined we would get so many people wanting to attend. And Eric and I just did one together last week that was very well attended. So prevention, providing education about suicide prevention, how to talk about suicide, how to access mental health services. I've spent a lot of time in the past couple of years really helping primary care physicians, outpatient mental health workers, whether they're psychologists, social workers, counselors, just understand Oakland County's system and then how to actually access services. So providing education, continuing to reduce stigma around mental health, and allowing people to be okay with asking for help and accessing services, I think would be wonderful.
And Dana, you're actually on our county recovery task force. Thank you for that. And I know you've been sharing that at the task force and on the subcommittee that deals with that. But just sort of in general, the kinds of support or programs that you think are going to be critical for the longer term.
I think the first thing is what both the ladies said, is access and crisis services. And we want to do crisis prevention in that we have urgent care. So really looking at how we partner and how we set up several different options for people before they get to the point of going to the ED or the crisis center.
Yeah.
Those things are needed. Of course they are, but we want to prevent full-blown crisis. And if as much as we can do that by screening, when we send somebody to urgent care, or someone goes to urgent care, we should be screening for mental health needs. And so that's one way. The other way is with the workforce. We talk a lot about our direct support professionals, our direct care workers who work in residential settings. These are the essential workers for us, and the people who work in inpatient, the people who support the master's level or licensed clinicians, the people who are essential really do the hands-on work, and they are underpaid. And so we're really looking at how do we boost their credentials, but also how do we support them in terms of, we had people who lived with people in their homes because they could not staff the homes. We had homes where people had to transfer to other homes because of staffing. And so transportation is an issue, having reliable transportation, but really having a meaningful wage where if you can work at Taco Bell and make more, and I'm not knocking Taco Bell, I love Taco Bell, but if you could work at Taco Bell and make more money than working and caring for a loved one, I mean, that's really sad if you think about the quality and where we put life. And then finally, I would say too, really with our children, there's a special need to have an integrated system of care for children. They are sitting in EDs, which just blows my mind as a parent. It breaks my heart. I can't even imagine sitting in an ED for one day, let alone several days. And that's that's a major problem and concern we have. So we serve people who are Medicaid, uninsured or underinsured. So we do a lot of that through Medicaid funding. But additional dollars where we can put into services and the staffing are critical,
Okay.
really critical.
Thank you. Thank you. So just briefly, I'll ask you as my last question. If someone's at home watching this, they're concerned that maybe a family member might have a mental health issue, or that they might have one, something they're experiencing or seeing that they haven't seen before. What should they do? What's your recommendation for the
We have
support
several
that they
options.
need? Yeah.
One, we have a no wrong door system. Any of our core providers are providers that we partner with in the community, they can approach and access services. The other thing is we have a crisis line, and the number is 1-800-231-2003. And the other thing is
We'll put that in the comments. So
Please.
yeah. We'll put
and our non-emergency phone line for access or any questions with our customer service, just to help people get directed. And if you've never addressed or had a family member or friend who needed mental health services, you have no idea how to navigate it. So even if you have private insurance, I always tell people, look at the back of your insurance card. But it's so easy just to call our number and we can help you navigate some of that. And so that people don't have to go to multiple hoops and things. Because when you ask for help, you want it to be available at that time.
Yeah. Anything to add to that? That was pretty succinct.
I mean, that was pretty, that she got it, but I
Yeah.
would also say, you know, and us as CNS Healthcare and other organizations also offer health screenings, you know, behavioral health screenings on their website. So if you go like to cnshealthcare.org,
Yeah.
there'll be a mental health screener, and so you can, you know, check it out for yourself, to see if, you know, how immediate you might need to, but definitely everything Dana just said in terms of the resources is there too.
Absolutely. And Havenwyck, our intake department is open 24/7. Every phone is answered by a licensed social worker or registered nurse. So you can call us at 248-373-9200.
Awesome. And I think, even though I didn't hear any of you say this directly, I heard you all say it. I think the key thing is don't ignore it. Take it seriously. If it feels different, if you're not sure, it's, you know, either through the website or through the phone calls. Reach out and get some help. You're not alone. It's not unusual, and there's a lot of help available, which is great. So this has all been wonderful. I really appreciate all three of you being here. Thanks for taking the time to do this. And of course, if you need mental health services beyond what these three providers have talked about, you can always go to our website where we have a list of all the providers in the county. You can go to oakgov.com/COVID, and in there there'll be a section on mental health services. So, and by the way, if you're looking to get the vaccine, I still want to encourage you to do that. That's still very important. You can also go to oaklandcountyvaccine.com. It's still really important. It's the smartest thing you can do for yourself and your family. So thanks for listening. Be good to each other. And ladies, thank you so much for your time today.
Thank you.